We'll start. Welcome all to the today's live session. Today's topic is Zika virus infection and pregnancy. We begin with our quote, Master MRCOG with concept-oriented clarity. So this Zika virus, one of the important topic from the examination point of view, they may ask you about the SBAs or EMQs also from this particular topic. It's a very small topic, hardly 5-7 minutes it will take. So this Zika virus is endemic in certain regions of America, Caribbean countries, then much of Africa and Asia. And there was outbreak somewhere between 2015 and 16. So most cases were mild and asymptomatic. The symptomatic illness generally lasts for 2 to 7 days. Remember, the duration of illness is around 2 to 7 days. Okay. So pregnancy, what complications can happen during pregnancy? Pregnancy, it can lead to congenital Zika syndrome that is identified by the microcephaly and brain abnormalities. So whenever you get a clinical feature of microcephaly, please think of this Zika also in one of the differential diagnosis. Okay. And most of the time, in certain questions, the hint is about the history of travel and certain countries. Okay, so you should know the which country, which infection is common, or if there is any recent outbreak. Okay, so that also you should know that those questions are likely to ask in the examination. Okay, and in neurological, it can lead to Guillain-Barré syndrome, that is GBS, because it's a post-viral GBS. It's also common with Zika virus. Okay, then spreading factors, immunologically native population is prone, and Aedes aegypti mosquito is the main vector for this. Now let's see about something about the transmission and the symptoms. So transmission is by the bite of infected female Aedes or the Aedes aegypti mosquito. Incubation period is around 3 to 12 days. This Aedes aegypti is not present in the UK because it cannot breed in the UK. So most of the people who travel to the countries where it is endemic, those people are very high risk. Okay, same thing is about malaria also. Then maternal fetal transmission is known to happen. Virus is also detected in the breast milk, but transmission is not proved. Breastfeeding always benefits outweigh the risk. Sexual transmission from male to female, male to male, and female to male is known to happen via vaginal, anal, oral, and sex toys. Virus in semen can be detected up to 188 days, but it is infectious through the semen up to 69 days. Okay. This is one of the important things because the contraception is advised. We'll see the importance of this in the subsequent slides because the SBAs or the EMQs are asked on this. Okay, so virus is detected into the semen up to 180 days, but it is infectious up to 69 days. Okay, vaginal secretions, menstrual blood, it is present. The risk of sexual transmission is low and possible via the transmission is also possible via the blood transfusion. Okay. Now coming to the symptom, most of the time the symptoms are very mild or asymptomatic. The illness generally lasts for 2 to 7 days and the incubation period is 3 to 12 days. Okay. Then there is a rash, itching, fever, headache. Arthralgia is very typical of Zika virus. Okay. So if you get arthralgia, arthritis, myalgia, conjunctivitis, low back pain, retroorbital pain, and there may be you may have the clinical feature may mimic dengue and chikungunya and requires lab testing. And complications we have already discussed. One of the complication is about the microcephaly in the fetus, and this can also lead to the GBS. Okay, so these are the complications can happen due to the Zika virus. Now coming to the congenital Zika virus syndrome, it refers to the range of abnormalities and not just the microcephaly following in utero exposure to Zika virus. Risk of birth defect appears lower than CMV or rubella, but Zika infection can be widespread during the outbreaks. So adverse outcome rates vary across the study. Timing matters. Infection is, if it happens early in the gestation, there is a high risk which can happen to this particular congenital Zika virus syndrome to the baby than in the latter pregnancy. Then cranial abnormalities could be microcephaly, cerebral ocular calcifications, ventriculomegaly, periventricular cyst, callosal abnormalities, microphthalmia, cerebral atrophy that is less than 5th percentile, Vermean agenesis, Black cyst, megacisterna magna, more than 95th percentile, choroid plexus cyst, brain atrophy, microencephaly, cortical white matter abnormalities, ergyria, etc. So if you see this particular, generally they give you the ultrasound features and all these features, and you may get confused between the CMV, you may get confused between this Zika virus and n number of viruses, CMV, toxo. There will be 10 to 12 differential diagnoses, and out of which you have to select one. So please read carefully the history of travel. Then there will be certain buzzwords also, like as I told you, the symptoms, okay, arthralgia and all. And accordingly, you select the proper answer. Then extracranial abnormalities can be fetal growth restrictions, oligohydramnios, talipus, etc. So Zika virus prevention, as such, there is no vaccine or drug which is currently available. Mosquito activity, this Aedes aegypti is active during the daytime, okay, and the malaria mosquito is mainly active in the night time. So mid morning and late afternoon to dusk, this mosquito is very active. So personal protection, wear light colored loose long sleeved clothing, especially in the daytime. Treat clothing and nets with permethrin. Retreat after 6 months. Use mosquito nets if no screening or AC, even daytime. Yes, repellents, DEET equal to or less than 50%, okay, are most effective, and it is safe in pregnancy. So this is used in the cream format, this DEET, and it is safe and effective. So DEET concentration is up to 50%, can be safely used in the pregnancy, okay. Breastfeeding and children more than 2 months, it can be used. Then apply repellent or the sunscreen, because you need to have the higher SPF factor, because DEET will reduce the SPF. So you need, when you are using the DEET, you need to have sun protecting factor of higher, around 30 to 50 at least, okay. And reapply after swimming, washing, or heavy sweating, etc. Generally the questions are, but this information you should know, especially in part 3 during communication, this is all required. Then what is not recommended is citronella oil, vitamin B1, B12, tea tree oil, etc. General advice is to avoid contact with the repellent with eyes, mouth, etc., etc. And always provide the information leaflet for the travels. Now let's see about the advice, because the questions are asked on this. So let us concentrate now. What is the travel advice which is given to pregnant women and couples who are planning the pregnancy? Okay, so recommendations for the pregnant woman. Now here the lady is pregnant, and either she or the both couple or maybe husband, they want to travel to, the scenario will be like that, okay, or either they have returned from the country and they are asking about the contraception. So now this is the planned travel, okay. Recommendations for the pregnant women: if there is a current outbreak in the destination country, then postpone non-essential travel until after the pregnancy, okay. So if there is a current outbreak at destination, postpone the non-essential travel, okay. Then countries with a past or recent outbreak, or there is an endemic risk, there is no current outbreak but there is an endemic risk in that particular area, again consider postponing non-essential travel, okay. Here you consider postponing the non-essential travel. If travel is unavoidable, ask them to follow strict mosquito bite prevention, okay. There is no chemoprophylaxis for this, but when we'll learn about malaria, you'll find that there is a chemoprophylaxis, and the questions are asked on that also. And always use barrier methods for vaginal, anal, oral sex during and after travel throughout pregnancy, even if there are no symptoms. After returning, always inform GP, obstetricians, midwife, and monitor the case, okay. So couples who are planning the pregnancy, so check Zika virus status of the destination before travel. So these are the couple, the lady is non-pregnant, but they are planning the pregnancy, wants to travel to the destination where Zika virus infection is there. So check the status of that particular destination before travel. If asymptomatic screening, there is no, it is not available in the NHS, consider avoiding travel to Zika risk countries rather than delaying the conception, especially if the patient is on assisted conception program, okay. So it's better to avoid the travel rather than the delaying conception, okay. Now coming to the diagnosis and management of Zika virus and the pregnancy with respect to the pregnancy context, okay. So when to suspect and what test is to be done. So if there are symptoms within 2 weeks of travel to the Zika virus or Zika risk area, in that particular case, you need to suspect and test that particular lady. Or there are symptoms within 2 weeks of the sexual contact with a male partner who has traveled in the last 3 months. Okay, so the partner, if he has got a history of travel in the last 3 months, but if there is a sexual contact within the last 2 weeks and if she is symptomatic, then you need to suspect and test her. Okay. Then third is a pregnant women with compatible symptoms after return. So this sample is to be sent to the RIPL, that is rare and infectious disease pathology lab. Okay. Then asymptomatic travelers, there is no testing which is available in the NHS. Then testing samples will be sent to the RIPL, that is rare infectious pathology lab, with full travel and pregnancy detail. Test will depend upon whether symptoms are current or past. Amniotic fluid PCR is also possible, but sensitivity and clinical value is uncertain. And negative antibody after 4 weeks after the exposure, that will exclude the recent infection. Okay, so this particular after 4 weeks, if you repeat, and if it is negative, that will exclude the recent infection. Okay, then there is no specific antiviral treatment. Illness usually mild and self-limiting. Supportive care, rest, hydration, paracetamol, cooling measures, etc. Severe prolonged illness will require medical review. Okay, here you just remember when will you suspect and what test will you carry out. So when to carry out, where the sample is to be sent to the RIPL, and it will be done if she is a pregnant and there is a history of travel and symptomatic, you test her. Or if there are symptoms within 2 weeks of travel to the Zika risk area, or if there is a sexual contact within 2 weeks with a male partner who has traveled in the past 3 months. So, okay, these are the indications for suspicion and testing for Zika. Okay, now this is one of the important where the questions are generally asked. What is the advice for couples considering the pregnancy? Okay, so they need a contraceptive advice, and the contraceptive advice differs for male and female, or if the couple is traveling. Okay, now if they are traveling to Zika risk area, so what will be the advice? Avoid conception during the travel and use contraception barrier method. Okay, if they are traveling to Zika risk area, the conception should be avoided. Then what should be the after return? If both are traveling, then delay the conception for up to 3 months. Okay, so the conception is to be delayed for 3 months if both are traveling. Okay, after return, if there is only male partner is traveling and they are considering the pregnancy, then delay the conception for 3 months. We have seen how many days this virus is there into the semen. What was the what we discussed, Dr. Sinchana?
Infective for 69 days, and it remains for 188 days.
Correct. So it is it can be found into the semen up to 188 days, but it is infectious up to 69 days. Okay, so 3 months of contraception is advised if the male partner is traveling. Okay, and if only female is traveling, then delay the conception for 2 months. Okay, and if symptomatic woman post travel, avoid pregnancy for next 2 months. Okay, so if there is a travel, but if she is symptomatic, then avoid the pregnancy for next 2 months. So generally they ask you the questions on this, what will be the advice in this scenario. Okay, then another advice, you use condom or barrier methods during or after travel to prevent the sexual transmission. And what does the FSRH say? Start effective contraception before travel itself. Okay, then pregnant women and partner travel. Okay, if partner has visited Zika risk area, use condoms or barrier methods for entire pregnancy. Okay, if the partner has visited, then in that particular case, use condoms or barrier methods for entire. So all these will be the options for the question. So you please select depending upon the scenario which is given to you. Who has traveled? What is the situation? Okay, then and whether she's a pregnant or not. If she is a pregnant, then still the for the entire pregnancy use condom and barrier methods. Here there will be no question about delay conception because she is pregnant. Okay, then consider specialist input testing if partner is symptomatic. Then pregnant women, she is symptomatic or exposed. This is the scenario now. Next scenario. So either current or previous symptoms, the sample will be sent to the RIPL. If it is positive, baseline ultrasound and referral to the fetal medicine service will be done, and consider other travel infections like malaria, rash, and other causes are also need to be taken into account. Now, if the woman is pregnant and she's asymptomatic, we have already discussed for asymptomatic, there is no test. Okay, so routine testing is not available, but the baseline ultrasound can be advised and repeat at around 18 to 20 weeks, and you may consider to repeat ultrasound again at 28 to 30 weeks of gestation. Okay. And what if there are fetal abnormalities like a microcephaly is there, intracranial calcifications are there? She will be referred to the fetal medicine specialist. Consider amniocentesis after 20 weeks of gestation, and PCR for Zika virus will be done. Consider fetal MRI for additional findings, and if Zika is confirmed and there are fetal abnormalities, counsel them for poor prognosis and termination may be discussed. Okay, so that finishes the Zika virus. Thank you.